BSI seen safe?
Seen as safe.
How many patients do I have?
1 patient.
And my call's for a diabetic emergency?
That's correct.
As I walk in, is my patient alert and tracking me?
Negative.
All right. Hey, sir. I'm Sean. I'm an EMT with Hall Ambulance. What can I do for you? Does the patient respond?
Patient responds verbally.
All right. Sir, what's your name?
Jonathan,
Do you know what year it is?
1942.
How many quarters are in a dollar?
6th.
And who's the president right now?
Kennedy.
All right, so my patient's alert and oriented times 1, his name only. He is a little bit altered. I'm feeling for a radial pulse at this time. He was talking to me, so his airway is open and patent. He is a little bit slow to respond. Is there any family around that I can talk to?
No.
No? Okay. So I got a strong regular radial pulse. Is that what I have in this scenario?
Yes.
Oh, okay. It's probably about 80.
114.
Okay. So this time, since he is a little bit altered, we're going to check a blood sugar, and I'm going to have my partner Carrie check a blood sugar for me, see what that is. I'm going to keep moving down through my assessment to see if I can figure anything else out. What are my skin signs?
Pale, cool, and diaphoretic.
Okay. Do I see any major bleeding?
No.
Okay. He is pale, cool, diaphoretic, so possibly going into shock. We're going to see what's going on with the blood sugar. We take a blood sugar. What does that come back as?
50.
50? Okay. So we're going to go on the route of hypoglycemia. We're going to administer him 15 grams of oral glucose. And is my patient able to swallow?
Yes.
All right. So since he's able to swallow, I'm going to hand him the tube and ask him to squeeze it into his mouth and swallow the glucose. If he was not able to swallow, we take it and put it on the tongue depressor and put it between his cheek and the gum. So before I administer oral glucose, we're going to get a blood pressure, full set of vital signs, just to be 100% sure and make sure there's nothing else going on. So he does have a strong radial pulse. My partner Carrie is going to get me a blood pressure. I'm going to go ahead and check pupils while she does that. Pupils are equal and reactive?
Yes.
Okay. I should have mentioned this before, but I'm going to consider C-spine as well. What's my nearest hospital?
5 minutes.
And how far out is ALS?
10 minutes.
All right, since hospital's closer than ALS, we're going to go ahead and transport this patient. At this time right now, I'm going to consider him low priority due to the fact that I haven't seen anything else going on except for his blood sugar being a little bit low at 50. We're going to go through now and what is the blood pressure?
Blood pressure is 108 over 64.
All right, and what is my pulse ox at?
97%.
All right, so all the other vital signs are checking out okay, so we are going to go ahead and administer the 15 grams oral glucose. I'm going to have the patient squeeze that into his mouth. I'm going to give it about 5 minutes and then reassess, check his blood sugar again. So after 5 minutes, we check his blood sugar again. What does it come back as?
82.
All right, so I'm going to reassess my alert and oriented status. Hey, sir. My name is Sean, EMT with Hall Ambulance. What's your first name?
John.
How many quarters in a dollar, John?
4.
Who's the president right now?
Biden.
And what year is it?
2021.
All right, so at this time, the patient's alert and oriented times 4. He does have a GCS at 15 at this time. Earlier, it would be a 14, so he has improved. Do you have any medical history, John?
I have a history of diabetes.
Okay, do you have any allergies?
No allergies.
What medications do you take?
I take insulin and metformin.
All right, when's the last time you took your insulin?
I took it this morning.
Okay, did you eat after you took it?
No.
Okay. Your blood sugar got a little bit low, okay? What were you doing before? What was the last thing you remembered?
Just watching TV.
Okay. So he does have a history of diabetes. He does take insulin metformin. He took it this morning, but he didn't eat after, so we're going to assume he took his insulin or one of his medications, which causes blood sugar to go low. Do you have any pain right now?
No pain.
Okay. Since he doesn't have any pain, OPQRST doesn't really apply to this because that's for pain, so there's not going to be anything that provokes, radiates, or makes it worse or better. So at this time, I'm going to reassess vital signs and get ready to make a transport to hospital. How far out from my hospital am I?
5 minutes.
All right, so I'm going to transport him to Venice Health. So Venice Health Hall 474 patient information.
Go ahead.
All right. One second. Hey, John, how old are you?
35.
All right. Hey, Adventist Hall 474, EMT Tennis. We're coming with a 35-year-old male. Chief complaint is going to be hypoglycemia. Got on scene. He was alert and oriented person only. GCS of 14. Did a finger stick of 50. We have administered 15 grams of oral glucose. He is currently alert and oriented times 4. GCS of 15. Finger stick came up to, I believe it was 80. Blood pressure was 108/72. Heart rate is 110, strong and regular at the radial. Respiratory rate is 16, non-labored. Lung sounds are clear and equal bilateral. I should have checked lung sounds, but I forgot to do that. Pupils are pearl. History of diabetes. Took his insulin this morning, but forgot to eat after. If you guys have any questions, orders will be there in about 5.
We'll see you in 5.
All right, and this concludes my medical assessment. All right, so that concluded my assessment. I did make a few errors on it, which happens, but we got to try and eliminate those. I forgot to say, get my lung sounds early on, which I should have done when I was doing those ABCs. That's when a good time for that. And for my secondary assessment, I didn't say which body systems were affected, which is going to be his integumentary and his neurologic. The integumentary because his skin signs were abnormal, and neurologic because initially when I got on scene, he wasn't completely alert and oriented. He was a little bit altered.